Hello, everyone. My name is Joanne Keithley. I'm the chair of the board of Innovative Response Globally for Trans Women and HIV, and I am chair of today's session, Pleasure Engineers, Trans People, and Sex Work. It's a pleasure to be with you today. And we have two great speakers for this session. First speaker is Jacques van der Kolk, who is a sexual health nurse and confidential counselor. And due to his experience and involvement with LGBTIQ and sex workers, he's the first contact for anyone who wants to report an abuse or malpractice. He's offering to make himself available for consultation or private talks. And you could run into him doing fieldwork in the Amsterdam LGBTQ and bars or via internet outreach. And then it's also my great pleasure to introduce Samira Hakim, who is a trans and sex work activist who currently works for Transgender Network Netherlands and is also a confidential counselor for PNG 292, which is Prostitution and Health Center in Amsterdam. She is the co-founder and secretary of the Trans United Netherlands and board member of the LGBT network of the PVDA in the Netherlands. In 2018, she was involved in the organization of a pre-conference, HIV Prevention Among Trans People, Advances and Challenges, AIDS 2018 in Amsterdam, in preparation for the 2018 AIDS conference. She's looking forward to addressing the issues that affect the trans community globally in regards to HIV and AIDS. And without further ado, it's a great pleasure to begin the session with Shamira. Will you be going first? I think it's Jacques first, right? I think it's Jacques. So we'll start.
Thank you for your invitation for this meeting. I will tell you about PNG 292 in Amsterdam, the Netherlands. PNG 292 is a partnership between HVO Querido, that's an NGO, and the Public Healthcare, the GGD, and that's a GO, financed by the municipality of Amsterdam. The goal of PNG 292 is to improve the emancipation and self-reliance of sex workers, whatever their sex workplace or residence status in the Netherlands is. PNG 292 tries to reach this goal by the improvement of the physical health of sex workers, strengthening their mental and social health, the improvement of their social and legal position, asking attention for forms of violence and sexual exploitation and acting against them, together with other organizations. Our vision is best described as based on two core values that are the starting point of our work in every respect: freedom to choose an occupation and physical integrity and resilience. I will tell you some history. In October 2000, prostitution was legalized in the Netherlands. In April 2008, PNG 292 was opened right in the center of Amsterdam. Apart from the medical care that the health authority provides for, a center for sex workers was needed, where they could get information on rights and duties, and at the same time help for mental and social matters, as well as a special shelter for victims of human trafficking. For that, we opened the Amsterdam Human Trafficking Center in Amsterdam at ACM. In 2009, there was an introduction of the project 1012. 1012 is a zip code of the red light district in Amsterdam. The goal of this project is to reduce criminality, trigger economic upgrade. In 2012, there was an introduction of a 5-year prostitution program. The city's prostitution policy was designed to involve the entire sex industry in strengthening the position of Amsterdam sex workers and combating abuses in both licensed and unlicensed branches. Important changes, businesses active in the sex industry were required to apply for a new license. Additional license requirements include intake and supervision. Operators who have concern about sex workers' safety or independence can contact the City of Amsterdam's advisory team for help. The sex workers' age was increased to 21 years. Sex workers need to speak at one language like Dutch, English, Spanish, or German. They need a Dutch or an EU document, and they need registration at the Chamber of Commerce. Consequently, about 23% of the windows have been closed since then. That's 112 windows out of the 470 windows they were. Before this program, we saw a lot of vulnerable sex workers, but after this program, we see more stronger sex workers in the licensed branch. But where did the other sex workers go? The law regulation sex work, the WRS, has not been passed yet. This law obliges sex workers to register themselves as sex worker. The minimum age will be raised to 21 years. Sex workers need to do an interview with an officer. The officer will decide if the sex worker is self-reliant enough to do sex work. And most sex workers do not want to register themselves because of their privacy. And we think that access to care will get worse. PNG 292 is easy accessible, located in the center of Amsterdam. We have flexible opening hours, consultation hours of healthcare, social assistance. All services are free of charge. The sex workers can come with their work name. We have comprehensive sexual health care. For example, illegal use of hormones by trans sex workers. We do STI screening. In 2019, with 2,222 screenings. We offer free hepatitis A and B vaccination. We offer PEP care and we offer PrEP care. But if the mountain won't come to Mohammed, then Mohammed must go to the mountain. So we also do outreach work. Outreach work, we go to the windows, we go to the clubs, to offer all kinds of services like STI tests or social assistance. In 2012, we started with online outreach. An increase of sex workers are working from home ever since the municipality started Project 2012 in the 5 years program. So we search on internet for new profiles. In 2019, we sent 1,007 text messages to female sex workers, 212 text messages to trans sex workers, and 387 emails to male sex workers. The following day, we tried to call them and to inform them about PNG 292 and what we all offer. Most of the time, we use a peer educator who speaks Spanish. This is also an ex-sex worker. We have special interventions to reach out to trans sex workers. At PNG, we start to work with a trans peer educator. She has a special consultation hour. We opened a lounge special for sex workers where they can meet other trans or other sex workers, or they can drink just a cup of coffee or tea and just relax. We started a sounding board group for trans sex workers. Every month, we organize a meeting with all kinds of subjects. In 2019, we started with PrEP care for trans sex workers. During the COVID-19 lockdown, sex workers stopped or went advertising on internet, the unlicensed sector. Therefore, we are making new intervention to reach the trans sex worker in the unlicensed sector. We are making a web scraper that will scrape the website for new sex workers advertisements. profile names and contact information are temporarily stored in a database. And with this data, we can inform sex workers on the internet about the offer of PNG 292. Now we do it manually. In this way, we hope to approach more new profiles and to make an effort. In the future, hopefully next year, we will opening a trans clinic. This clinic is for all trans people of color who do not have access to regular hormone treatment. We offer in this new clinic not only hormone treatment, but also STI testing and PrEP care.
Thank you for having me today. I will hope that you like my presentation. In 2018, Trans United Europe was founded to advocate and improve the position of trans people of color in the Netherlands and in Europe. One of our main aims is to inform policymakers and politicians about sex work, HIV, and the precarity amongst trans people of color living in the Netherlands. In 2018, we were asked by the municipality of Amsterdam to be part of a research project on the position and living conditions of trans people of color in Amsterdam. Together with two anthropologists of color, we started out doing the research. The research was a peer-to-peer qualitative research conducted by Trans United Europe among 40 trans people of color in Amsterdam, with a particular focus on the most vulnerable groups: refugees, sex workers, and people with HIV. Outcomes of the research led to a specific policy of the municipality of Amsterdam regarding the living conditions of trans people of color. Also, in 2019, the trans safe space in the red light district of Amsterdam opened. The trans safe space is for and by trans people of color and is a space for day shelter, community building, social projects, clothing projects, sports, and once a month, the trans health clinic for hormones. The offering includes consultation hours with police, lawyers, confidential counselors, and sexual health and HIV services. The location in the red light district in Amsterdam was specifically chosen because the red light district is a low threshold area for trans sex workers, which is familiar, has a good security, and is welcoming of trans people. Trans United Europe focuses on several key projects. One of them is community building. We do empowerment meetings, trainings of policymakers, police, and service providers. We are part of the Trans Pride Commission of the Pride of Amsterdam. We offer swimming classes specifically for trans people and self-defense courses, also specifically aimed at trans people. Secondly, we do capacity building. We speak about our causes, BIPOC trans perspective, access to healthcare, racism, and sex work with stakeholders like ILGA Europe, Trans Allies for Sex Work, HIV, and Trans People, and are part of conferences such as AIDS 2018, ILGA World, and ILGA Europe conferences. Thirdly, during COVID-19, together with other sex worker organizations in the Netherlands, we set up the Dutch Emergency Fund for sex workers. Through donations, we raised several thousand euros, which we could use to support the most vulnerable sex workers affected by the COVID-19 lockdown in the Netherlands. This was the Dutch Emergency Fund for sex workers. Since October 2020, Trans United has taken over the Dutch Emergency Fund, and we are currently looking to keep raising money so that we can still offer donations to the most vulnerable sex workers in the Netherlands. 4, we receive funding for sex work and COVID response. We are having funding to have a health and labor conference for BIPOC trans people to be held in 2021. And we are part of AIDS Fund Sex Works Coalition. Also, we do intersectional policy work with ICRSE and NSWP as member and as members and as board members. And we work with several stakeholders, such as the healthcare providers and social workers, to include our work in their specific projects. After a visit to the Key Clinic, which is an NH and trans community health project in London, the idea of the Trans Health Clinic by Trans United was born. And this project was started in 2018 in the red light districts in Amsterdam. This is an accessible clinic for trans people who don't have easy access to regular health care that is available in the Netherlands. The back office, the intake, admin, and a multi-language nursing is led by trans BIPOC, while the doctor team is a mix of trans and cis physicians. The focus is primarily on hormones, but we seek to enlarge our offerings in the future. During the intake, we saw a large amount of risky behavior of the clients. This includes chemsex use, street-based work, homelessness, patients with HIV or STDs. That is one of the reasons why we want to incorporate sexual health and social services into the offerings of the trans clinic. The clinic is for all trans people, not exclusively for sex workers. A part of our patient base cannot access PrEP care through sexual health care because they are not legal. In the second stage of the Trans Health Clinic, we are looking to work together with P&G to enlarge the offerings that we have in the health clinic. We like to offer more P2P services, starting with specialists and social workers, police, and human trafficking. We want to do HIV and STD testing on a peer-to-peer basis at safe space or by field work. We want to collaborate with HIV healthcare providers so we can offer PEP and PrEP service to the most vulnerable groups. The main aim for this is to enlarge the PrEP use among trans people. We also have a seat at the table at the H team, which is the HIV team in Amsterdam, where we work together with a lot of other organizations to get 0 new HIV infections in the Netherlands. We hope to achieve this before 2030.
We hope you liked our presentations, and we are now available to answer all your questions. So feel free to ask us anything you want.
Great, thank you very much, both Jacques and Samira. In hearing both of you speak, it occurred to me that maybe I should have spoken a little bit about why trans people engage in sex work in the first place, and what is the background for sex work for trans people? Why are we involved? Beyond being the pleasure engineers. But I think one of the things, and if you'll indulge me, I'll just speak from the heart here. As a former sex worker myself many years ago, and as a member of the trans community, this is something that is so important for us, I think, as trans people, because first of all, it is the oldest profession, the world's oldest profession. So it's not something that should be stigmatized. It is something that many people who are non-trans engage in. So I think that, sex work is work, as we say in our title. It is, a form of employment. But for trans people, often it is only the only source of employment that may be available to us. In so many countries, trans identities themselves are criminalized. And so often we are not able to participate in the workplace in non-sex work environments. We don't have access to employment at the local, grocery store, or as teachers, or as nurses, or as educators. Even though we have those types of skills, maybe, but often in many places around the world, we're not able to engage in non-sex work environments. And for many in the trans community, it's also a rite of passage because it's so common in our community. Young trans people, youth, often see it as a way to enter into the trans world. And they see that so many are engaged in sex work that they see it as, a way to connect with the community, that is the kind of entryway. For many of us, it's a last resort. For many of us, it's the only way to survive. If our parents are not accepting of us, if our siblings are not accepting of us, if our schools do not support our identities, our identity formation, it's the only way that we are able to survive out in the world. And there are many people who are willing to pay for our sexual services. And so that does afford at least an ability to survive in sometimes very hostile environments. And it's also a form of gender affirmation for many of us. For many of us, just the mere fact that someone is willing to pay us to engage in sex with us is a form of affirming our sense of masculinity or femininity, depending on your identity. And so that is also an important factor. I think it does come with risk, as your important work in the Netherlands. I'm sure you come across many instances of risk and also violence. And so, sex work, while it is work, it can also be a dangerous form of work. And there are disproportionate rates. We're not all in the Netherlands, and so we have disproportionate rates of arrests and convictions as a result of sex work throughout the world, and many trans people in jails and prisons as a result of their engaging in sex work and what I call walking while trans, because the assumption, for criminal justice is that if you're walking down the street and you're readily, identifiable as a trans person, you must be engaged in sex work. It doesn't matter if you're, walking down the street on your way to the pharmacy to pick up your HIV meds or to, go to the local grocery store. If you're trans and you're walking down the street, you must be engaged in sex work. And that's the first assumption that's often made by criminal justice people around the globe. So anyway, those are the things that I, thought of as you were speaking. So I, thank you for allowing me to kind of indulge with everyone about that. But I think it's an important context to just remind us of why we're engaged in sex work to begin with. And so with that, I'm going to now go over to questions. And also I'd like to remind the participants that are with us today that after this session, there was a Meet the Experts time that we had allotted, and we've decided to forego the Meet the Experts part of this session because we have lots of time for Q&A. And so we're going to ask you to send your questions through the chat function in Zoom here. And then I'm going to begin looking at the questions and see, it says no real questions yet. Okay. So, okay. Let's see. Well, there is a comment from Alexandra for Shamira. So, you know, acknowledging what a great job you're doing for our sisters in Amsterdam and in Europe, and hoping that you come back to Mexico very soon.
Thank you, Alejandra. I hope to see you very soon also. It was really nice meeting you back in Mexico last year. And I was just talking to Joanne, and we look forward to meeting everyone soon again.
Yes, yes. Yeah. So with since there are no questions in the chat function, maybe I'll just I'll ask a question of you all. So do you have a sense of, you know, what the ratio of trans sex workers is to non-trans sex workers in the Netherlands? Do you find, you know, that they're a significant portion of the sex working community?
About 5% of the sex workers that we see and that we see on the internet are trans, or identify as trans, of all the sex workers in the Netherlands.
I see. And now you mentioned in your talk, Shamira, that many of the sex workers are immigrants from other countries.
Most of them are immigrants, mostly from South America, of course. But we also see people from the Middle East, Asia, Eastern Europe.
I see. And so do Europeans, are European sex workers not participating in sex work?
Yes, they are, but they usually know their way through the system better than the immigrants. And I think there's also less sex workers amongst the native populations, call it like that, because of the social services available in the Netherlands. So there are, if you don't have a job, you can get support. There's no need to survive to do sex work. And for the migrant population, it's really a need to survive because of not being legal, doesn't give you access to these social services. So they have a need to do the sex work to survive. So I think that's also one of the main differences.
And we see a lot of sex workers from South America because prostitution is legalized in Amsterdam. So it's a kind of safer place to work. You can work in the windows. And if you work in the windows, there's a social
control.
Social control. So it's much more safe than if you work on the internet in the unlicensed.
Although most trans sex workers, even in the Netherlands, work in the unlicensed sector.
I see. So in certain websites or chat rooms.
And there's also a little bit of street walking still going on, but it's getting less and less because of the new rules introduced in the Netherlands. So it's mostly gone through the internet.
I see. Now, Alexandra is saying here, I want to know if helping undocumented trans sex workers are part of the services offered in Amsterdam and in Europe.
Absolutely. Your legal status doesn't matter for us. If you come for us for help, we can help you anyway. This can be psychological, medical. It can be help with your procedure if you want to apply for asylum, for example. So we offer all these kind of services, even if you're not legal.
I see. And she also asks, are you aware of any similar projects in other European countries? And can you say a few words about the situation in other European countries?
Not specifically. I know there are rainbow houses in several cities in Europe, like Brussels and in Spain. But a specific trans house, I think, is one of the first to be in Europe. And I think it's very important that it's trans-specific, because even within the LGBT community, there is a stigma surrounding trans people. So it's very important for trans people to feel safe. And that's why we had a separate space only for trans people. And then especially trans people of color, because they are the main portion of the population in Amsterdam. So I think that's very important. And the municipality of Amsterdam finds this group very important because they are like one of the most vulnerable groups in the LGBT community. So they need extra support and attention. So I think this is one of the first projects specifically for trans people in Europe. I know that in the United States there are similar projects. Maybe Joanne, you can say something about this, but in Europe I think it's unique.
Yeah, great. So let's see now. There is a question from Alicia, from Andreas. She wants to know if, oh, sorry, I already asked that question. Alexandra is saying, so she's asking about legalization, and that's part of the services that you're offering, right?
Yes.
And,
yes.
And then that's it for the questions. Okay, so in terms of programs in the United States for sex workers, there are projects, regional projects. Of course, you know, in most places in the United States, most states in the United States, it is, prostitution, sex work is considered illegal. There are some, there's Nevada is one state, you know, that has legalized sex work in controlled environments. You know, we don't have the windows like you do in Amsterdam, but there are places where sex work can occur in the state of Nevada. But the rest of the country doesn't have legalized sex work. And so it's still a cause for criminalization in most places in the US. And, you know, quite the source of, you know, stigmatizing and criminalization, you know, a source of a lot of heartache for trans people in the US. And so we haven't done an effective job of educating society about, you know, the plight of trans people, the reasons, as, you know, I mentioned a few minutes ago, about why trans people engage in sex work. I think we need to do a better job of that. Yeah.
Yeah, and we need to do that here in the Netherlands. There is still, in the Netherlands, most of the time, sex work is seen as the same as human trafficking in many cases. Right. A lot of people that don't work in the sector think that it's always related to human trafficking. So that makes it very difficult sometimes to, if we go to, for example, the refugee centers where refugees live while they're in procedure. There is a lot of sex work going on, but it's not discussable because they see it as something difficult and something strange and something that's related to human trafficking, while sometimes, of course, it is. But in most cases, this is a choice by, well, choice. It's a free job that people do because they are in a difficult situation, and that makes discussion sometimes very difficult because people have a certain mindset that is very difficult to break through because if you have the mindset that it's always human trafficking, it's very difficult to see it as a real job, because then you see it always as something that is forced upon someone. So that makes the discussion very difficult sometimes.
Yeah.
So
Alexandra is pointing out that Ella para Trans Latinas in San Francisco helps trans immigrant sex workers in the US. That's just one project of many, many around the country that actually do provide some supportive services for trans sex workers all throughout the US. I think the other thing that I wanted to point out in terms of you know, sex work in the United States is that you know, in my former life as a researcher at the University of California, San Francisco, before I retired, I engaged in lots of research activities in trans communities. And, you know, many years ago, we conducted an HIV risk behavior study where we had a pretty large sample of trans women, particularly of color, so African American, Latina, Asian Pacific Islander, and Native American, and some Caucasian, some white. But when we looked at the total sample size of the people that we had interviewed, we asked about, condomless sex with different kinds of sex partners. And what we found in a pretty large sample, it was over 700 participants, is that trans sex workers actually have had good access to information about the risks associated with condomless sex. And by and large, unless they were coerced or enticed into not using condoms with clients because the client was offering so much money that it was worth not using the condom, that by and large, trans sex workers did use condoms when they were engaged in sex with their clients, but less so with their what we called, casual partners when they were having sex for fun, or with their partners, when they were romantically involved. And so the primary, exposure to HIV was not through their sex work. And so that was very clear in our research that sex work did not lead to higher rates of HIV, but it was the other factors that were, the causal agents for HIV positivity rates. So I just wanted to throw that out there as something that we need to keep mindful of, that actually through efforts, from projects like your own that educate sex workers around safe practices and risk reduction, we can actually have an impact on HIV transmission beyond the sex work activities. So I don't know if you want to just add.
We saw the same thing, and not only with trans sex workers, but also with female and male sex workers, that most of the STD infections are in the private sphere, so not in the working sphere. And we are now actively prescribing PrEP. Especially, there is a project going on in the Netherlands. It was mainly aimed at MSM, but through the municipal health service, we had an allocation of a couple of hundred spaces, especially for sex workers, where sex workers can get reduced, can get PrEP at a reduced rate of €7 a month. So we're trying to broaden our appeal, and we are going to do how do you say this? We're going to do a public campaign about this, because we do see that sometimes it's very difficult to reach trans people for PrEP, because the main campaign is usually targeting MSM. So there's some work to do in that, because we need to make sure that PrEP reaches the right people, and trans sex workers are one of the main risk groups here in the Netherlands. So that's our aim, and we hope that we can start this from January next year. And then we try to increase the usage of PrEP among trans sex workers, because now it's only like 50, 60 people in the program that are trans. Less. So less than 60 people that are currently on PrEP through the new system. So we hope to increase that, so that we can reach a lot of people that are willing to take PrEP.
Yeah, and you can use PrEP in two different ways. You can take PrEP when you have sex, or when you plan you have sex, or you can take it every day. And what we advise to all the sex workers to use the PrEP every day, because then the risk when you have sex for your private pleasure, then you're used to use the PrEP every day. So you don't have to think about it. Oh, this is private. Oh, now you have to use PrEP or not. If you use it every day, it's more effective, I think, and you don't have to think about it because you have your alarm clock every day and you can take your medication. The side effects of PrEP, that's a minimum at this moment.
Mm. So maybe you could speak a little bit more about PrEP and, you know, the ways in which it's supported, you know, and provided in the Netherlands. You say, you know, the campaign so far has been primarily focused on men who have sex with men. But is there funding for PrEP? Is it, you know, do trans, you know, sex workers have ready access to PrEP if they choose to take it, and who pays for it?
Yeah, there's a special program in Amsterdam, in the Netherlands, and from Amsterdam we choose to include also trans and male sex workers. So we try to get in contact with sex workers by internet, and we tell them what we offer for services, and then we talk also about the PrEP care. And for all the sex workers, it's very easy to include, because as a sex worker, you are a high risk person, so you're always included for the PrEP care. And well, we noticed that PrEP, because it's now €7.50 for 30 tablets for 1 month, everyone can afford it. So that's why we try to include as much as sex workers there are in Amsterdam who want to use PrEP.
So if you're not part of the program, it costs about 20 to 30 euros a month, and you can get it to your general petition.
Yeah.
But the aim is, we're working with SOA AIDS Netherlands as an organization, as Trans United. The aim is to have access to PrEP for everyone at the price of €7.50, regardless of if you're a risk group or not. So we are lobbying for that, so that, like I said, we hope that by 2030 there will be 0 new infections in the Netherlands. And that is the main aim of this lobbying that we are doing right now. So we hope that in the next couple of years we can offer it for a very low price or even for free. That's the goal, that we can offer it for free to everyone.
And when you start with the PrEP, we give it only for the first 30 days. Then we can see if you have side effects. And if you have no side effect, then you can continue. We monitoring it by blood and urine samples, and that's how we can continue and see that there's no side effects.
I see. So you say 20 to 30 euros per month is, you know, the out-of-pocket cost for PrEP. And is that, you know, readily, you know, do trans people, regardless of, you know, their document status or their engagement in sex work, would that be a reasonable amount for them? You know, I mean, in Latin America, you know, 20 to 30 euros, I think that translates to about $40 or $50. So that would be a barrier for trans people in Latin America to use PrEP. I mean, you know, it would be beyond their means. And so, you know, sometimes a trans person in Latin America will have $50 a month in income. And so I'm just wondering, you know, if that is something that is within their means or if it's a barrier. Do you consider it a barrier?
Yeah, especially for people still in the procedure, in the asylum procedure, it's a barrier because they don't have a lot of money. So we're trying, if they go to the program at the municipal health service, it only costs €7.50 a month, because the government will partly pay for the PrEP. But it can be quite difficult to get a space in the program because there's a lot of people that want to join the program because of the lower costs. But we try to get the most vulnerable people to access the program because that's the program is for. So that's what we try to do. And then it's only €7.50 a month.
Especially, And especially for sex workers who are not have documents.
Oh,
So,
yeah, yeah.
Because they don't.
Yeah. So Alexandra is pointing out that trans sex workers in Mexico City, and I would actually generalize this to probably trans sex workers all over the globe, are being really disproportionately impacted as a result of COVID-19. Their COVID-19 is threatening their ability to engage in sex work, and in resource poor settings, and I think in the global South, it's really challenging. So I don't know if you could speak to that for the trans sex workers in Amsterdam, if COVID-19 is complicating their ability to work, or what do you think?
Yes, we never had a full lockdown in Amsterdam, in the Netherlands. So there was always a lot of sex workers, even if they were working legally in the windows, had to quit their job, but they could still work from home. And we saw that a lot of them do this, but it's more a risk because you're exposed in your own house. So it can be quite dangerous.
Yeah.
And a lot of the trans sex workers in the Netherlands are not legalized. Even if they have the right documents to stay in the Netherlands, they are not allowed to work as a sex worker because you need to register. So they weren't able to access the social service provided to people who lost their job because of COVID. That's why we set up the fund together with a couple of other sex work organizations here in the Netherlands. And we got donations through Facebook and through our websites. And we provided basic donations of 40 euros a week to the most vulnerable sex workers. So people that were not legal, people who had other problems, people that were homeless, because we also saw that because they couldn't do sex work, they couldn't pay their rent, and they were kicked out of their house. So we provided as much as we could, but we can only provide 40 euros a week for the basic needs, for food. So that's what we did. We, during the summer, sex work started up again, but it was still the number of clients was very low.
I see.
A lot of sex workers complained because, for example, if the cafes and the restaurants closed, then the business in the red light district is a lot less because there are no tourists. Right. So we still see that there are a lot of problems, but it's not as bad as in other countries where there was a real lockdown and people couldn't go outside and there was no income at all. In the Netherlands, we saw that at least there was some income.
Yeah. Related to that, I was wondering, I know that, in the red light district, there's the windows, but the windows are only, that's a work environment, right? And so is there, are there specific locations where trans sex workers are, working out of? And then is that work location only for work? Do they then go to another place where they live? And do they live together, or do they, live separately? I'm wondering if you can describe that for us.
Yeah, in the red light district, there are 2 streets specifically for trans sex workers. This is also a little bit problematic because this is grown out of the discrimination of trans sex workers, because a lot of female sex workers didn't want to work with trans sex workers next to them because they were afraid that the client would think they are also trans. So this kind of organically developed that there were 2 streets where trans sex workers could work. We're trying to change this. We are talking with the municipality of Amsterdam because there is also a window operator that is grown from sex workers, that's run by sex workers, and their trans sex workers can work in the same windows as the women. So we're trying to broaden the work field for trans sex workers. And you can rent the window, but you cannot live there. So you rent the window for a day shift or a night shift, and then you go home. And many of them live together because the rents in Amsterdam are really high. So they share a house because to lower the cost. So a lot of trans sex workers live together. I certainly see this.
I see. Great, thank you. Nagoda is reminding me to remind everyone that we're not going to have a meet the experts afterwards. So I guess we're encouraging people to ask their questions now if they have them. You know, we're getting close, I think, to the end of our session, but we still have time for more questions. So I'm inviting all of the attendees who are still with us to please ask your questions in the chat space so that we can, you know, hear from our esteemed speakers who are sharing their wealth of knowledge. So let's see. Know that other people are. Here we go. It looks like we have about 5 more minutes left, so soon. But and seeing if there's another question or so, but doesn't look like it. Maybe I'll ask more questions off the top of my head. So do you have a sense of what the average income is for a trans sex worker in Netherlands, in Amsterdam? Is it vary in different cities in Amsterdam? Yeah.
It varies a lot.
A
lot of, I would say that the window workers, they would in a good period with a lot of clients in the weekends and weekend night, they can earn up to 1,500 or 2,000 euros a night. But lately it has been a lot less. So now they're happy with 200 or 300 euros.
I see. Yeah.
A lot of this sex workers that work from the website, so that do homework, they make usually a lot more money because they ask the price is higher if you go to someone at home. And I would say if they're lucky, they can easily make 2,000 euros a day if they're lucky.
If they're lucky, yeah. And then do you have a sense, are they using the funds to, you know, then, you know, seek gender affirmation surgeries? What are, you know, 2,000 euros is a lot of money, right? So what are they using that money to, you know, then affirm their sense of self? Are they sending it home to people in their home countries? You know, what do they do with those resources?
I think they do both. I see a lot of surgeries getting done because of the money they make. And they send a lot of money. A lot of families in Latin America are dependable on the income from the sex, not only the trans sex workers, but also the female sex workers. So you see that a lot of these sex workers, they feed a whole family back in Ecuador or Venezuela. Studies for children, housing. So it's not only helping themselves, but also helping their families. So it's a really important income. So now with COVID, it makes it very difficult because they also feel guilty because they cannot send the money to their family.
Yeah, yeah. So, and do you have a sense that the income is different in different parts of Amsterdam and other parts of Europe, obviously. So is it dramatically more in Amsterdam than other parts of the Netherlands, or do you have a sense of that?
Well, there is less competition in other parts of the Netherlands, so sometimes that helps increase your income if you go to another part of the Netherlands. I also think that it's in some countries like in Northern Europe, like Sweden, Finland, where there is a restrictive prostitution policy, that the income is also higher because there are more risk associated with being a sex worker. While I think Southern Europe.
Sorry, my dog. Reality, right?
He wants attention.
Yes.
Well, I think in Southern Europe, the income is usually lower because there's a lot more competition, because a lot of Latin American sex workers, they go to Spain or Italy.
Yeah.
Because of the language, there's no language barrier. There are a lot of people they know from back in their countries. So it's easily more accessible than, for example, the Netherlands or Sweden. So that makes that the income is lower because there's more competition of other sex workers.
And do you have a sense that now, you know, if you're undocumented in the Netherlands and you're engaged in sex work, is it more costly to engage in you know, surgical procedures, interventions like gender affirmation surgeries? You know, is there a higher out-of-pocket cost if you're undocumented? Or
No.
do you have access to those kinds of services?
Yeah,
If
if you say, for example, if you want to do a breast augmentation, the cost would be the same if it would be the same for me as for someone who's undocumented. There's no difference in pricing there. I don't know how it is in other European countries, but at least in the Netherlands, there's no difference.
Oh, that's good. Yeah, great. So I think I don't see any other questions. I don't know if you would like to add anything that we haven't discussed, you know, at this point. I just, you know, want to open it up for you to kind of share your last thoughts before the end of our session.
Well, I hope that we can work together also with the organizations in Latin America, where a lot of the sex workers in the Netherlands come from, to see how we can help them there, because we see that the living conditions in those countries are one of the main reasons that they come to the Netherlands, where they live in difficult, even in the Netherlands, they live in difficult situations, not legalized, access to health is more difficult. It's possible, but it's difficult. So I think there should be more cooperation with especially trans organizations in Latin America and Spain, maybe, to improve the living conditions of trans people in those countries, so that we can make sure that they don't have to leave their country. That's one of my goals, that we can achieve this, because we just had TDOR and we had 350. In Holland, we had one name extra because one girl got killed 2 weeks before TDOR, unfortunately. There are 350 names. Probably there are a lot of more trans people murdered than there's 350 that we don't know of. So I think that we should really try to aim. And I think that we from the West, from the United States, from Europe, have a big role to play in this, I think. Because a lot of these organizations are not financially capable of doing this kind of work. And I think we should push our governments more to do more about the situation. What we did as Transgender Network Netherlands, we made a research about, because a lot of Latin trans people ask for asylum in the Netherlands, but they get rejected, almost all of them, because the Dutch government says the living conditions are safe in the countries of origin, because there are laws protecting trans people, protecting LGBT people. And for example, the Dutch government gets their information from the embassies in the country of origins, but this information is based on the living condition of gay people. So completely different area. Than most trans people. So we made a research about this as TNN, and we're going to present it to the government next year. So we hope that the government can at least look at this application from trans people in the correct way, with the correct living conditions. And we hope that the Dutch government can play a role, because they do this in other countries, in the Middle East, in Africa, in Turkey, regarding the position of LGBT people. So I really hope that the Dutch government can also do this regarding the situation of trans people in Latin America. So that's something we are working on, and I think we should, in the West, should be aware of the privilege that we have here, and so that's my that's what I want to give back to all of you.
Wonderful. Thank you very much. Yeah. Jacques, did you want to add anything?
No, I think I agree with Samira. I'm very happy that I can announce that the trans clinic will start in January in Amsterdam, and I'm happy that we can start giving this service to the trans community, and we can offer hormones, PrEP, STI care, and I'm very happy for.
Yeah. Well, you know, on behalf of our community, I want to thank you both for the wonderful work that you're doing. I think that it's critical that projects like the one you're engaged in continue to provide the services that you do and reach the people that you're reaching. I think it's such a critical, you know, service. And we need to replicate the services that you're providing. I think, you know, there is a role for organizations that have done the work to foster and to support the rollout of the services in other places, like you say, Samira. So I'm really hopeful that, you know, post-COVID, we'll have opportunities to continue to work together and to share the important lessons that we're learning from your work and from other projects like yours. So I really want to thank you for the work that you're doing and for spending the time that you did today with us. I think we're almost out of time here. So I do want to remind people that after this session, there won't be a Meet the Experts session. So, you know, this was our opportunity to meet with the experts. I do want to invite people to join the closing, the end of the session. I think in order to do that, maybe Goda, if you could chime in. I think that in order to join the ending, we will have to see if there's slides here. I don't think so, but there might be. No? Okay, there are slides here. So I want to once again acknowledge our corporate support from Beeve and from Gilead for providing resources, you know, for not just this session, but also for the meeting as a whole. I also want to thank all of the endorsers. You know, you can see here the different organizations that were involved in the planning and in the endorsing of this important workshop over yesterday and today. And there is also a survey and certificate of attendance that you know, we're asking, you know, first of all, for you to participate in the survey so that we can, you know, figure out what worked, what we could do better, etc. So please do complete the survey. And also, I think you'll be asked if you want a certificate of attendance. And so you can, you'll get a link for that, I believe, from the organizers. And I want to thank you for attending this session, and we look forward for your participation next year, hopefully live somewhere. We, you know, we appreciated the ability to deliver the information live stream, but there is really nothing like in-person meetings with, you know, our wonderful colleagues. So we look forward to the next time that we can actually get together in person and have further discussions about these very important issues. So without further ado, I just want to thank you once again to the fabulous speakers. And thank you, Goda, and all of the organizers. And we'll see you.